Once your patient has selected a CBTi program and is going through it, they can visit the Sleepwell website for tools and resources to help them along the way. This is especially helpful for people using one of the recommended CBTi books, and it may also complement some of the more basic digital CBTi programs. CBTi includes 5 components: stimulus control, or control, time and bed restriction therapy, which we refer to as sleep drive, relaxation techniques, or relax, cognitive therapy, or thoughts, and sleep hygiene. There are multiple behavioral, cognitive, and educational active ingredients blended into these 5 components. Considered together as a family of evidence-based sleep-enhancing interventions, it is important to recognize that not all components are necessary for a person to experience a satisfying and sustained improvement in their sleep. Many patients experience substantial improvement with the sleep routine modifications of stimulus control and time and bed restriction therapy and find no need for relaxation or cognitive therapies, while other patients benefit from using relaxation techniques as part of their nightly routine or using various cognitive techniques to address their false and dysfunctional beliefs about sleep. Clicking on each of the 5 icons takes you to an overview of each component and resources and tools that can be used when applying that component. You can find the 5 icons on the homepage, CBTi page, and Sleepwell Recommends page. Let's quickly take a look at each of them. The control page includes a brief description of the behavioral therapy known as stimulus control. Most important are the set of rules to follow that are designed to break the conditioned response of being in bed and being too activated by worry of not being able to sleep to be able to sleep. An important rule is to not stay in bed past 20 minutes of trying to get to sleep. To help with this, we include a few 20-minute white noise audio tracks for your patients to use. If they're awake after the track ends, they are to leave the bed and only return when feeling sleepy. By the way, some sleep experts recommend 15 minutes and others 30 minutes before leaving the bed. The idea here really is to leave the bed so you don't perpetuate the conditioned response of feeling a sense of doom or frustration when lying in bed. The next CBTi component is time in bed restriction therapy, also known as sleep restriction therapy, a term we tend not to use with our patients. It's a behavioral intervention that works to directly increase your sleep drive. Combined with stimulus control, these 2 components can be very effective for improving sleep over a very short period of time, even after years of chronic insomnia. This component involves tracking sleep, using a sleep diary, which we include for downloading and printing, and estimating sleep numbers, which you can do at the end of the week using Sleepwell's sleep calculator. The main numbers are time in bed, which starts when you get into bed to start your night and ends when you get out of bed to start your day, time in bed awake, and time in bed asleep. And the ratio of time in bed asleep to time in bed is your sleep efficiency. Using the sleep calculator, you can complete your sleep diary for last night's sleep, or you can do it for a typical sleep from the past week and let it do the math for you. Click Calculate to see your sleep numbers and what is recommended for the next week's sleep schedule based on your sleep's calculated sleep efficiency. The classic approach to time and bed restriction therapy begins by assessing your sleep numbers for the past week. If sleep efficiency is less than 85%, the first step is to reduce your time in bed to match your time asleep from the previous week, or 6 hours, whichever is higher. At the end of the subsequent weeks, you adjust your time in bed based on your sleep efficiency for the week. Higher sleep efficiency means more time in bed and usually longer sleeps. This can be the most challenging part of CBTi. It can be modified if not acceptable to the patient or not recommended for health reasons or safety reasons. Even with less rigid reductions of time in bed, the benefits on sleep continuity can be substantial. On the Relax page, we provide instruction and links to a range of recommended relaxation techniques that can be added to a bedtime routine. Some are done before getting into bed, and others can be done while in bed after turning off the lights. Patients should be encouraged to try a few different techniques before they decide which one they prefer. They can take a bit of practice to feel comfortable with and get good at the technique. It can be important to remind your patient of this and to encourage them to keep practicing the technique. Self-help approaches to CBTi can include a range of cognitive techniques, including cognitive restructuring, in which you learn to challenge your beliefs about sleep and insomnia, which can be causing sleep stress and make it that much more difficult to relax and fall asleep. The Insomnia Beliefs Quiz is the DBAS, or Dysfunctional Beliefs About Sleep 16-item questionnaire. It can be used to help identify thought patterns that can interfere with sleep and how to address them. We also include various distraction techniques that are used to replace the thoughts that can cause stress and cognitive hyperarousal. Overlapping with relaxation techniques, these cognitive tricks can be used while in bed after turning out the lights. The final component is sleep hygiene. often described by sleep psychologists as the least effective component of CBTi because most people who have chronic insomnia have already attempted to resolve their sleep problems by optimizing their sleep hygiene. To help you make sure you haven't missed anything obvious, use our sleep hygiene checklist. It's dynamic, like a fillable form that can be printed so it's flexible and can be used in a variety of ways to help your patient work on their sleep hygiene. So in this quick review of the 5 main components of CBTi, I've briefly described the component, the tools and resources available to your patients that can help them use each of these techniques, and some of the challenges of CBTi that you may need to support them through. Lastly, I'm sure you've noticed that we offer easy access to several of Sleepwell's core tools on the right side of the page. The layout may be a bit different if you're looking on your phone or tablet versus your computer. I hope this quick orientation enables you to support your patients as they progress through any CBTi program.